My name is Ken Dauber, and I would like to welcome you to Plain Orthopedics, and thank you for giving me the opportunity to take care of you. A little bit about myself. I was born in the East Coast of the United States. I moved to Houston in the 5th grade and lived there until I graduated from high school. Graduated from the University of Texas in 1992, and then went back to the East Coast for medical school. I graduated from Syracuse for medical school and decided it was too cold and decided to move back to the Texas area. I did a year of an internship at Presbyterian Hospital of Dallas and then 3 years of residency at UT Southwestern in Dallas. Following that, I joined Plain Orthopedics in 2000. So I get a lot of questions from people, what is physical medicine and rehabilitation, since I'm in an orthopedic practice and I'm one of the 2 non-orthopedists. What we focus on in physical medicine and rehabilitation is returning someone back to their previous level of function. And we use a variety of techniques to do that, whether that's medications, physical therapy, injections, or unfortunately, if necessary, sending to one of the surgeons for surgical intervention. I want to go through what my philosophy with patients are. The most important thing to me is getting the patient in a timely manner. Obviously, a patient that has to wait weeks or months to get into a physician is going to develop secondary issues, whether that's lost time at work, lost time at school, or even just losing the opportunity to do the things they love. Once someone is seen, the first thing I always like to do is to take a good history and perform a good physical examination. If we do that, we can generally figure out what is going on with most of the patients. And then the last thing is, I believe in incorporating the patients into whatever the treatments are going to be. I believe that an agreement with the doctor and making sure that we all believe in the same thing helps the patient to really move forward in their treatments. One other thing that I believe in my philosophy is I see the patients on every office visit. Every time you're here, you'll get an opportunity to speak with me. POSMC provides the best care in the Metroplex. You are seen by the doctor on every office visit, and I believe that's important, so if you have questions and there's issues, those can be directly addressed with the physician. The doctors in this practice work very well together. If I have an issue and I need someone else to look at you, they are right down the hall, and we can make a quick visit with the other doctor to get their opinion. We have all the equipment and all the things that we need here in the office to be able to get you or your family members moving in the right direction. I still like the challenge of finding out what's wrong with the patient, instituting a plan, helping someone to be able to get back to work, get back to school, get back to walking normally. When I see a patient and they send their parents to see me, or they send their brother to see me, or their kids to see me, that tells me that I've done a good job, and it really gives me a warm feeling inside. When I get a hug from a patient who has not been able to go to work or has not been able to play pickleball, whatever their sport is, that still gets me up every day wanting to come to work.